Hi everyone, Russ here from the Training Institute. We're going to talk about anxiety disorders. Anxiety disorders are probably the most prevalent mental health diagnosis you're going to see in the programs, in the system, but also generally out there in the culture and in society. Very common among youth and often paired with depression. So if you think of anxiety and depression, that's going to make up the majority of the mental health concerns that people are dealing with today, at least. And incredibly costly to society in terms of trips to the ER, hospital usage, clinic usage, time off from work, that kind of thing, and then really costly to the individual in terms of the effect that they have on their relationships, potentially on their work, on their recreational life, that kind of thing. So this is a really important topic that we need to dig into if you're going to be effective working in mental health. And I think a really good way in is to think about fear and anxiety, all right? And what we're going to see is that people inadvertently are kind of mixing them up, all right? And I'll explain how that works as we go. So think about, like, what are you afraid of? What's something that you're really fearful of? Typically, people will say things like, tornadoes or snakes, things that really are an imminent threat to one's existence. That's you're supposed to be afraid of those things so that you can respond accordingly. Anxiety is a little bit different. It's to do with the anticipation of things happening. So it's things aren't really happening, but they might. So anxiety is you're thinking into the future and you're anticipating something bad. All right. Now, what's very interesting here is that the solutions are different. Okay, so what I mean by that is if you're afraid of, heights, okay, then the best way around that is to avoid heights. All right, so you're controlling the situation by avoiding the thing you're afraid of. Makes sense? So if you're afraid of snakes, then avoid situations where you're likely to encounter a snake. Okay, that's pretty effective most of the time. Now, what happens is people inadvertently treat anxiety exactly the same. Okay, so what are we anxious about? If you ask people, a typical group will say things like, well, I would get very anxious if I had to do public speaking, okay? And so what do people do to control that? They avoid public speaking. Well, that's maybe not that's maybe not viable if your job requires you to do a little public speaking from time to time. So what happens is people use the same strategy for anxiety than they do for fear, and that leaves them in a kind of deficit in their life. Because if they're anxious about going to school, or anxious about going to work, or anxious about going to the youth lacrosse team meeting, to use a youth example, what people are going to do now is avoid those things. So we're not playing lacrosse, and we're not showing up for work, and we're not operating well at school. And so we want to be able to teach people and coach them that the thing that they're anxious about, that anxiety is not the same thing as fear. What's really interesting, though, is the physical sensations are the same. All right, so when we look at the DSM, if you look at the symptoms for anxiety, What's so fascinating, as you can see from the list, is most of them are physical, right? So, you got heart is racing, or palpitations, you're sweaty, muscles are tense. These are physical symptoms, okay? And they're the same symptoms as if you were really responding with fear. So it's kind of difficult to understand the difference, okay? What's in common, though, is that anxiety and fear are about control, all right? So I want to control the situation, but how do I do it? If I'm anxious and I control what I'm anxious about by avoiding it, then my life is going to be it's going to be disrupted quite a bit, and potentially to an almost catastrophic degree if it meets the definition of an actual disorder. So I like to look at thinking about my responses to anxiety as behaviors, and I'm going to call them control behaviors. All right. So I'm going to try and control the anxiety by adopting a certain set of strategies. What's so interesting here is that the strategies to control anxiety, they usually make the anxiety worse in the long term, right? So that's kind of bad, but they usually alleviate the anxiety in the short term, all right? So what's going on here? Okay, examples, all right? So if I'm nervous about the youth lacrosse meeting or the soccer meeting with the coaches, and I've got anxiety, one good strategy in the short term is to not go to that meeting. That I controlled it, right? But now my place on the team is in jeopardy. Now I'm not connected with my teammates. Now I don't know what's going on with the team, et cetera, et cetera. Okay, so my short-term strategy for controlling anxiety is going to lead to long-term deleterious effects on my life. And I'm going to get into a pattern here where it's like, yeah, well, that's like how I live. I avoid this, I avoid that, I avoid the other. And it also teaches me inadvertently that I actually cannot handle the meeting. I cannot handle the social interaction. I cannot handle the head coach talking to everybody. And so I'm becoming less and less and less effective in the world instead of more and more and more as I grow out into my life. So we have to keep in mind that, and you'll see this with your clients, the things that they do to alleviate their anxiety, isolating, escaping, avoiding, performing compulsive, ritualistic behavior, relying on a support object, or support people. The more they do those behaviors, the more anxious long-term they're going to be. All right? So the solution is to teach them other ways to alleviate their anxiety so they can go to the meeting. But that's the very last thing they want to do. So there's a kind of contradiction there that we have to break through in treatment. Anxiety, as you can see, that it's kind of normal. It's normal to be anxious. All right? You need it, actually. If you have an important situation that you're going to attend to, like a meeting, like an interview, like your driving test, your first game in that lacrosse season, you want a bit of anxiety, right? It's a signal from your body, hey, pay attention. Like, this is important. Get yourself together, all right? All that practice you did, this is the time to perform. It's manageable when it's like this. It won't significantly affect your psychology, but you're feeling it, all right? Where anxiety crosses over into becoming a disorder is where it becomes excessive. It's out of proportion to the actual perceived threat, right? It becomes unmanageable and it starts to affect a person's life in a very significant way. So it's one thing to be nervous and anxious about going to the office because there's an important thing happening. It's quite another when that person simply can't leave the house and then can't be employed in that situation or in that employment. So what clinicians look for is that difference. So keep in mind that anxiety is a word that's used in kind of general parlance, and it's also used clinically. And so you want to take a look at the diagnostic criteria, and you'll see things like has to be very significant, has to be happening for a certain amount of time, typically like 6 months. So being anxious one day doesn't mean a person has a disorder, but being anxious repeatedly in a variety of contexts that's disruptive for 6 months, that could be a disorder. As we think about people with anxiety, it's really useful to consider what doesn't work, right? What doesn't work is telling them not to be anxious. That's almost the worst thing that you can do. But it's pretty natural. Don't worry about it. Don't be anxious. Be positive. Knock it off. That kind of thing generally doesn't work. And so when clinicians work with someone with anxiety, they do not go in that direction. Instead, they work around the cognitive elements of their thinking, right? How they're thinking and the behaviors, how they're coping, what their control strategies are. And therapy points out how long-term disruptive that is and then works with the client to develop new strategies. What perpetuates anxiety? This is an interesting one. 10% roughly relate to sickness. All right, so sickness can be real or imagined. If it's anxiety, it's thinking about it in the future. Oh, I'm gonna get sick, or this is gonna become very serious. 12% of anxiety is thinking about the affairs of others that actually don't even concern us. Right? A lot of this is things that we have no control over whatsoever, which is probably why it produces anxiety. 30% of things that people are anxious about happened in the past. And you cannot change the past. 40% are things we worry about that never even happen. All right? And only 8% of the things we worry about are even likely to happen. So that all added up to 100, as you can see. But that's really rather remarkable. So part of therapy, part of treatment is getting people to understand that many of the things that they're thinking about as threats really aren't. All right? They're imagined future disasters that usually don't happen. The main thing that perpetuates anxiety is thinking. In a way, it's a disorder of thinking. Thinking. Zebras don't get anxiety disorders. Why not? They live in a pretty dangerous environment, much more dangerous than you and me. They don't think in the same way as us. They don't project into the future, worry about what might happen tomorrow. It's a thinking disorder. So in order to treat and address it, the therapist, the counselor, the clinician has to address thinking with their client, which is kind of an interesting thing to do. You end up thinking about your thinking, which for many people is a little bit unusual, and most people need a guide to do that effectively, and now we're basically talking about therapy. thinking, thinking, thinking. A couple of things to keep in mind too is we have certain implicit biases that go against us here. One is negativity, the negativity bias, the notion that when you have two experiences of equal intensity, one negative and one positive, we have a tendency to focus on the negative. We remember it, we think about it, we perseverate about it, we project it back into the future, and we sort of forget about the positive, because what about the negative, right? And we get into a kind of what if thinking. I mean, that would be a good way to encapsulate anxiety in one phrase. It's a disorder of what if, what if, what if, what if, what if. Another is confirmation bias. Confirmation bias is you don't know you're doing it, but you have a way of thinking, right? And you tend to notice, almost seek out evidence that confirms what you're already thinking, right? So if your thoughts are full of anxiety, then you're going to see things around you that confirm that you should be anxious. So there's a lot that is going on in our brains that's going to feed anxiety once we're on that track. It's somewhat cumulative. Part of the solution is to do a little psychoeducation and understand how our brains work and how thinking about perceived threats can be very useful within reason. If it goes too far, it becomes disruptive and deleterious to our health. Another thing that keeps us anxious is the existence of other mental health problems like depression especially. Depression and anxiety are almost always paired together. You know, it's just so common. Depression and anxiety. I'm anxious about my depression and I'm depressed about my anxiety. And in a way it becomes my whole way of being. Then I get into negative self-talk. I get into a sort of lack of assertiveness in my life. I become more and more anxious, more and more depressed. There's a point where we need help to break free of that. One of the best ways to free it is to think about physical health. Okay, I would say that activity is the antidote to anxiety. Okay, I'm going to repeat that. Activity is the antidote to anxiety. If a person, and this is unfortunately what happens because of the avoidance, right? Sitting at home, avoiding, and now inactive, thinking, 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 and not actually engaged in a lot of activity. Getting out there, moving, exercising, just doing stuff is usually the best antidote to anxiety. What happens then is people end up with an overactive sympathetic nervous system. So in our autonomic nervous system, we have these two branches, right? There's the sympathetic. This is the nervous response that primes us for action, pumps up our heart rate, dilates our pupils, accelerates our breathing, and various other physiological responses. That's one side. The other side is called the parasympathetic, and this slows us down, reduces our blood pressure, slows our breathing, activates our vagus nerve, things that reduce, things that calm. And people with an anxiety disorder tend to get out of balance where their sympathetic nervous system is out of balance, out of whack, if you like. It's overactive. So part of the solution is to learn how to do things that stimulate this parasympathetic side. And I'll list a few techniques in a minute that people can do. So much going on that sort of perpetuates anxiety. The other thing to keep in mind is it co-occurs with so many things. I spoke about depression, but it also co-occurs with substance use disorders, where people feel anxious and then realize that, for example, if they take a drink, it makes them feel a little calmer. So now they become so prone to doing that as a coping strategy. Sitting at home, avoiding the world. And this is the wrong track towards physical and mental health. They also, and this is fascinating, one anxiety disorder often leads to another one. So let me list now a few of these disorders, because so far I've been speaking about anxiety kind of generally. So that is an anxiety disorder, generalized anxiety disorder, right? But what else could be on this list? Well, panic disorder. That's where people have panic attacks. So once you have a panic attack, right, then you have a likelihood of having another one. And the fear and thought of having another panic attack, so you don't go out or don't go to the meeting or don't go to the class, now you have a panic disorder. And you can have both, of course. Also in this list are all the phobias, all right? So anxiety around a particular thing, a phobia, a fear of snakes, a fear of tunnels, a fear of heights, a fear of crossing bridges. The list is almost endless. Now, think about if you had a phobia of crossing bridges and you lived where I live in St. Paul, that would mean I wouldn't be able to go to Minneapolis at all. That's a very severe and important restriction on my life. And that's kind of what happens, is like, I'm going to try and avoid that bridge and that one and that one. So now my world is getting smaller. And it's sort of contracting in, and that's the problem. So the person with the anxiety disorder will think, well, I know how to navigate this, Russ. I just avoid the bridges. Or I just avoid flying. There's a common one, right? Fear of flying. Well, okay, you don't fly, but now you don't go here, you don't go there, and your world is smaller. And so at some point, we have to help people sort of face that fear and learn how to get on that plane and how to drive across that bridge and get into the next city and expand world and then open up life's possibilities. So phobias are really important. Agoraphobia, this is sort of like where people are, they're fearful about like being out in public, because sort of public situations where they think they're going to suffer extreme embarrassment. It could be something like meeting new people, any kind of public speaking, eating in public is one, that kind of thing. I don't want to be out there because things are going to go wrong. Agoraphobia. There's social anxiety, it's specific to meeting new people or being around people you don't know. And then separation anxiety, which you see in children where they're, overly reactive to being separated from the people to whom they are securely attached. And more of these are being developed informally, which is very interesting. Climate anxiety, different types of health anxiety. I heard recently that people have menu anxiety, and that's a fear of ordering the wrong thing. And so you avoid that and you get your friend to order for you in a restaurant. Incredible, right? And so what I want you to notice is the control behavior each time. The control behavior is, I'll avoid it. And that'll keep me safe. And in the short term, that's good, because, if my friend orders the wrong thing, I can blame him, and I don't have to take responsibility. I avoided it. But as the world collapses in, the possibilities for a productive, happy, functional life get smaller and smaller and smaller. So the solution is to create and develop different control behaviors, better ones that push us out into the world. But the problem is that's the very last thing that the person wants to do. So although the solution is relatively straightforward, it's extraordinarily difficult to do in practice. Let's talk about treatments then. The main thing to take away here, and the thing that would be most useful to talk to clients about, is the things that they're probably doing to like protect themselves from all these perceived threats are the very things that promote and encourage the anxiety in the first place. So protecting yourself from that public speaking engagement is going to increase the fear of public speaking, not diminish it, right? Minimizing the anxiety, don't talk about it. Like, give it a name and talk about it and attack it. Avoiding it will increase it. And simply continuing with the same behaviors, which is the most likely thing that people are doing, all right? Not confronting the fear. These are the things that promote anxiety. And if we come back to public speaking for a second, right? If you have an important speech to make, the thing to do is to prepare, is to practice, is to get in front of a mirror and do it over and over and over again. And you prepare and practice, and that's how you get over the fear. And then when you've done one, you think, well, that wasn't as bad as I thought, maybe I can do another, and that's the solution. So we want to get people to move away from, I'm going to control the situation by avoiding, to moving, I'm going to control the situation by getting some help, doing some practice, doing some preparation, and taking control in that way. All right, so both of those are control sort of solutions, but they're very different. One is empowering and sort of moving out into the world, and one is sort of avoiding and coming away from the world. All right, so what you're going to see is that people with anxiety disorders are probably very likely to be using medication, and that can be really, really helpful. You'll see them on anti-anxiety meds, obviously. But you'll also see a lot of antidepressants. You're going to see, because antidepressants like the SSRIs, selective serotonin reuptake inhibitors, they're pretty useful off-label for anxiety as well as depression, so that's pretty common, and they help reduce the symptoms, right? So that, this would be the model, so that the person can work on the solutions. So it's not quite so devastating and fearful. Only taking medication and not doing any new control behaviors, new preparation practice, only perpetuates the anxiety, and now I need the medications to function. So the best solution in the literature, the best practice is to use medication and therapy combined at the same time. The treatment of choice for anxiety, all anxiety disorders, without question, today is cognitive behavioral therapy. So if you think about those words, cognitive, the therapist will address the thought processes and patterns and the behaviors in a therapeutic way, and point out, help the client see that their thinking led to a certain behavior that led to a certain outcome, usually avoidance. And they'll work to change the thought pattern, try different behaviors to get a new outcome. And they just keep trying things over and over until they start to create a pathway out of the anxiety. Okay. Very important in that therapy, the therapist will help the client, in addition, address emotions and also their body. This is so important with anxiety because it shows up in your body. You know, your heart races, right? So that's a signal. Oh, I'm getting anxious. I'm getting a fear response. What is happening? And so they put, when the therapy is done well, those things all line up together so the person can understand, oh, I'm having this response in my body and in my emotional brain, and now I'm having these automatic thoughts, which I'm learning to label, and I'm going to replace them with different kinds of thoughts and affirmations, and I'm going to come up with different behaviors that are healthier, more productive, and more like going out into the world rather than withdrawing in. That's the trajectory of the therapy, of the treatment. But remember, that's the last thing the person wants to do. And so it's very useful to use your motivational interviewing. Get them thinking about what the goal is. Like, why do you want to be on the lacrosse team? Get them to imagine a beautiful future, getting that varsity letter, in their senior year when they've been on this team, and work towards that, because they're going to need motivation to do this difficult thing, to really work against their natural inclination, which is to stay at home and stay safe. See what I mean? So there's a number of different strategies that you can be using at the same time. Out in the therapeutic world, they use exposure therapy. It's done in a very controlled environment. It's a guided re-experiencing of the event that triggered distress. And sort of we're headed towards trauma work here and post-traumatic stress disorder. But for example, you could have a situation like where a veteran would watch a war movie over and over and over under the guidance with the guidance of a therapist, to reduce the impact. The constant exposure over time becomes less and less and less impactful, and they can manage their symptoms as they go, using breathing techniques and other similar things to manage their anxiety. And they learn, when I get these anxious symptoms, I can manage them. I don't have to just avoid the whole thing. So one or two techniques. I just mentioned breathing. The idea, just coming back around, is to learn how to stimulate the parasympathetic nervous system, all right? And that's the calming branch of your autonomic nervous system, all right? So when that's stimulated, your breathing drops down, your heart rate drops down, your blood pressure reduces a little bit, you sweat a little less, and you can promote these physical responses through certain techniques. Different types of breathing activities are very, very important. A therapist can teach these to their client. Mindfulness is a really good approach. People become aware of the difference between present and future. That's especially important, because my thinking is in the future. That's where the anxiety is. Mindfulness-based stress reduction brings me back into the present, the here and now, where I'm sitting at this table talking to you and things are actually fine, okay? Mindfulness-based means that you label any emotions that you're feeling, and that's it, you label it. Oh, I'm feeling anxious. Oh, I'm feeling threatened, but it's not happening. I take a breath, and you learn how to manage it rather than avoid it. You'll see a lot of interventions and techniques related to things like visualization. These are things you can learn under the guidance of a practitioner, a professional. Meditation, coloring, things like progressive muscle relaxation. All of these are designed to get me to say, I'm feeling this anxiety, but I'm actually able to manage it right here using a technique, rather than just running away, essentially. And helping the client develop a kind of narrative that they can they can talk to themselves in a different way. That, oh, I'm feeling anxiety. I recognize this. This is how it goes for me. This is what it feels like. This is how it feels in my body. Well, when that happens, I'm going to do these things. I'm going to do my breathing. I'm going to go and take a little walk. I'm going to come back. I'm going to do my self-talk, etc., etc. So we're equipping the client with a set of tools, they're called coping strategies, is often how they're referred to. And people develop their own little set, and they're often very simple, right? They don't have to be complicated. And that's a good thing. You don't want complicated strategies when you're under stress. You want simple ones, and you can learn them, learn the physiology of it, and use them all the time. So as we wrap this up, the way to think about anxiety, or to help the client think about anxiety, is you're having a fear response in your body for something that's anticipated in the future. All right? In a way, your brain is it's had a trick played on it, right? If the threat was really in front of you, the fear response would be appropriate, right? If you had a bear in front of you, you need to respond quickly. You need high jolt of adrenaline and cortisol so you can run, so that your pupils dilate, so you can see what's going on, etc., etc. And really what's happening is you're getting the same fear response to a situation that isn't even happening. You're just thinking it's going to happen, so you address those thoughts. And people make remarkable recoveries from anxiety disorders, but they have to come along with the process. They have to be willing to engage. They have to think about the future, think about their goals. They need a guide. Usually they need a helping hand. They need someone safe because they're scared. But the efficacy of the treatments is really pretty high. So there's a lot of hope for a good outcome. And I really hope that you see that in your work, because that can be really fulfilling. You're working with a person with depression and anxiety. Don't lose hope. There's a lot of good treatment for that, and people can recover quite significantly and become really productive, happy members of society. So thank you for taking the time to deepen your knowledge and address anxiety disorders with your clients. We really appreciate it. Good luck, and see you next time.